Utah leads the nation in dental insurance reform, and we're beginning a 10-week podcast campaign from My Practice, My Business, celebrating Utah's groundbreaking dental insurance reforms. Each episode will break down one piece of legislation or advocacy focus, explaining how these laws strengthen practices, protect patients, and hopefully inspire other states to follow Utah's lead. Welcome back to the Legislation Podcast and YouTube broadcast, Episode 10, The Call to Action, Leadership Reform, and the Courage to Listen. We begin right there.
This episode isn't just the end of our 10-week campaign. It's the beginning of a conversation that the American Dental Association needs to start having.
Because if the ADA truly exists to unite the dental profession and advocate for providers and patients, then it's time to prove it.
Utah, not any other state, Utah has led the nation in dental insurance reform. We've passed laws that protect patients, empower providers, and hold insurance companies accountable, and yet silence. Not a word of recognition, not a mention, not a single update from the American Dental Association.
Utah's legislative wins are the proof of our progress. So let's go back through what Utah has accomplished because it's worth celebrating and it's definitely worth repeating.
So first, the Bundling, Network Leasing, and Downcoding Protections Law. This is known as House Bill 359, passed in 2021. This made Utah the first state in the nation to regulate write-offs caused by bundling. It stopped insurance companies from combining unrelated procedures to avoid paying fairly.
And then came House Bill 495, which was passed in 2025, and this was huge. It prohibited insurance companies from forcing write-offs for services that we provide, that we rendered. If a service was done, it had to be paid for, period, either by the insurance company or by the patient, and not by the dentist and the dental team.
In 2025, we also expanded timely filing to 6 months, prevented automatic virtual credit card re-enrollments, we protected dentists' rights as dispensing providers, and we stopped automatic recoupments that risked HIPAA violations.
Every single one of those laws represents fairness, transparency, and accountability. And Utah did what others said could not be done. And yet, these victories were met with silence from the very organization that's supposed to celebrate it.
So we have an accountability gap here. Enough is enough. The ADA needs to stop picking and choosing which laws to celebrate based on internal politics or bureaucratic relationships.
We get it. Reform can be uncomfortable. It forces hard conversations. But if the ADA's mission is to advocate for the profession, then ignoring meaningful reform is just simply unacceptable.
Any simple search online will tell you that the number one concern amongst dentists nationwide is insurance overregulation. This is the battle. This is the issue. So that's where leadership is needed, not in areas that look good in the press release, but don't change anything to the average dental provider.
When associations focus on irrelevant topics and sidestep the real pain points, it sends a message that they've lost touch with the people they claim to represent. The whole heart of the issue is leadership needs to listen.
We aren't calling for division. We're just calling for leadership that listens. This isn't an us versus them issue. This is about unity through action.
And the problem isn't that the ADA doesn't care, because they do. It's that too many in leadership positions simply don't understand the reality of modern dental practice. Some have never owned a practice. Some have never faced an insurance denial, fought for reimbursement, or managed a team paycheck that depends on those payments.
And yet, these are the people deciding what deserves advocacy. This has to change. We need leaders who know what it feels like to fight for their patients, who understand overhead, and who aren't afraid to stand up to corporate pressure.
And if the ADA wants to rebuild trust, it starts by admitting that they don't know what they don't know. and inviting those who do to help.
There's a cost of silence. This silence is not neutral. It's harmful. When the ADA refuses to highlight successful reforms, they rob other states of the blueprint to replicate them.
They slow down progress. They keep dentists isolated, struggling to reinvent the wheel in their own states, and instead of building off what's already been accomplished, what's already working.
Imagine how many more providers would benefit if the ADA simply said, look at what Utah did. You can do this too. This is all it takes. It takes acknowledgement, visibility, and unity.
And leadership isn't about control.
No.
It's about collaboration. And the longer the ADA stays quiet, the louder the frustration becomes.
This is a call for collaboration and not conflict. Again, to the ADA, we're not your enemy. We are your ally. We want to work with you, not against you.
And we've already done the hard work. The research, the drafting, the lobbying, the legislative wins. All we're asking is that you share it, you celebrate it. Help dentists in other states do the same. Contact your executive directors of your state dental associations. Let them know what we have done here. Have them call our executive director. Our executive director will call us and have us work with them. It's that simple.
Please redirect your focus towards what matters most. Regulating third-party payers, protecting your patients, and empowering providers that you're supposed to represent. That's where you'll rebuild credibility, and that's where you'll restore unity in this profession.
Dentistry doesn't need more bureaucracy. It needs brave leadership. It needs action. There's two types of leaders, effective and ineffective. We need effective leadership in the American Dental Association so that members want to stay in the association, so that attrition doesn't happen, so that we can regrow the ADA back to an organization that is trusted and valued.
So here's our challenge, not just to the ADA, but to every dental professional listening on this podcast, on our YouTube channel, and beyond. We want you to demand better.
And ask your association what they're doing about insurance reform. Ask them why they haven't adopted laws like Utah's. Ask your state associations. Ask them why they're not standing beside you when you need support.
And if you don't get answers, keep asking, because this profession doesn't change through silence. It changes through persistence.
And in my practice, my business, we've shown that reform isn't just possible, it's achievable. We've written laws, we've passed them, we've proven that this model works. The model of dentists working together with the state association. When we can listen to each other and when we can be proactive, then it works and it works well.
Now's the time for the American Dental Association to do what it was created to do. Unite us, please. Advocate for us, please. And empower us to create a lasting change for the patients that we serve.
When leadership listens, progress happens. When leadership ignores, the profession suffers. We believe it's time to listen again. We want to thank the Utah Dental Association, more specifically, our Executive Director, Val Radmal. He has been absolutely instrumental in unwavering support for what we do. We want to thank his assistant, Becky, and the other one, Dottie, who unfortunately retires this year, and we will miss her. We want to personally especially thank Representative Jim Dunnigan. I think it's really important that all of you out there understand this. When we first met Representative Dunnigan, we learned that he is a member of NCOIL, the National Coalition of Insurance Legislators. He sells insurance. He's in the insurance industry. And we really questioned why we were referred to him to work with him as a legislator. And I'll tell you what, I've never met a more honorable and fair man in anywhere in our state government. And he definitely has been a fair and non-judgmental person to work with. And we hope we never lose him. You know, we hope he continues to run for office, because things that we've wanted to do, he has shut us down on. Things that make sense, he has supported us. And then he has always put us in front of the insurance representatives on every law we've passed, or every law that we've written up, because Representative Dunnigan's the one that passes them. Him, the legislature, the Senate, and then our governor signs it into law. And what an exciting and wonderful thing it has been to bring insurance reform in a way no other state has brought it in the state of Utah. Utah's a leader. Utah is a state where ethics and morals and values continue to be the mantra of what we try and do each and every day, month and year. What an honor it has been to work with all of them, and especially my hardworking wife, Tracy. If anybody really understood, which I think that Representative Jim Dunnigan and Dr. Val Radmal, I think they understand exactly how hard Tracy works. It's not me having to tell them, but they have personally watched her work countless hours on behalf of dentists and dental teams and the patients that they serve here in the state of Utah. And I am just grateful to be along for the ride with this wonderful wife of mine. Thanks, Tracy, for all you've done for dentistry. And I look forward to many more years of serving those that we care about. Thank you.
I do as well.
We hope you have a great day, and we hope you continue to listen to our podcast and watch us on our YouTube channel, and continue to learn and grow and help your team's docs, and teams help your docs, and then help those that you serve. Thank you so much. We appreciate all of our clients and their support. A portion of all of our training always goes to legislation, and that legislation is now slowly filtrating out to other states. We appreciate your support and grateful for you. Have a great day.